The pillar procedure is an effective first-line treatment for the palatal component of sleep-disordered breathing, including snoring and obstructive sleep apnea, commonly referred to as OSA. It is designed to produce a lasting effect without surgically removing or damaging tissue. First, let's examine how the palate can cause or contribute to snoring and sleep apnea. Airflow through passages at the back of the mouth and throat creates instability in soft palate tissue, causing these tissues to vibrate. This vibration results in snoring sounds. In the case of sleep apnea, the airway is blocked when the soft tissue, like the palate, collapses and blocks the airway during sleep. The soft palate plays a significant role in both snoring and sleep apnea. The patented pillar procedure provides a simple, innovative approach to treating the soft palate component of sleep-disordered breathing without an aggressive surgical procedure. The pillar procedure works by stiffening palate tissue to reduce both the vibration that causes snoring and the ability of the soft palate to obstruct the airway. Placing 3 tiny inserts, each less than an inch long, in the soft palate, the pillar procedure is a simple process for both snoring and OSA patients. The procedure takes only a single brief office visit using a local anesthetic to quickly insert the pillar product with minimal discomfort and far less recovery time than more invasive procedures. Most patients can resume normal diet and activities the same day. As air passes over the palate, the stiffening effect created by the pillar procedure reduces soft palate vibration and obstruction for as long as the inserts are in place. Made of a material used in medical devices for many years, pillar inserts are designed to be invisible and should not be felt or interfere with swallowing or speech after placement. Studies estimate that many snoring and sleep apnea sufferers have a soft palate component that contributes to their condition. Pillar inserts stiffen the soft palate, much like struts stiffen and add stability to an airplane wing. Here is a cross-sectional view of the pillar product at insertion. Over time, a tissue capsule forms around the inserts, adding rigidity. This natural tissue response increases the structural integrity of the soft palate, further reducing vibration that can cause or contribute to snoring and the obstructions that cause sleep apnea. Most patients soon report a noticeable lasting reduction in snoring, and most patients with sleep apnea may see the number of sleep apnea events diminish significantly.